characters. Grandchildren.
Good morning.
Morning.
Thank you so much for having my abstract, or our sharing of cystic fibrosis in the U.S. And thank you so much for being a first-time attendee and now a member of the IAPS.
Welcome.
So my objectives for today's talk is just really share with you how the care of cystic fibrosis have evolved. So we'll first visit the background and the history of CF. Then we'll describe briefly the pathophysiology and clinical manifestations. We also want to recognize what has changed in the current era of cystic fibrosis, and we'll discuss briefly the revolutionary CFTR modulator therapies. So 56 years, that's a wow. And for individuals born within that range 2018 to 2022, they are expected to survive until 56 years of age. And how many individuals are living with CF? In the United States, as of our last registry in 2022, there's about 32,000 individuals. Here in Ireland, their last report of the registry in 2019, they have 1,423 individuals in the registry, and there's 105,000 affected CF individuals worldwide. So history of CF, it really dates back, actually even further than 1700s, when somebody kisses a child on the forehead and tastes salty. That child is bewitched and soon will die. It was in 1930s that the science of cystic fibrosis have evolved. Dr. Dorothy Anderson from Columbia in New York published her first paper. She actually have compared what seemingly is celiac disease, but it's really a different kind of entity from a histologic standpoint. So now we see the different phases of cystic fibrosis. You can see on your left side a 2-year-old with already an abnormal x-ray and really severely malnourished. Now we have CF newborn screening universally in the United States, and you cannot really tell who is a healthy baby with that of a cystic fibrosis baby. And there's really advances in CF care. You can see from the evolution of pancreatic enzymes and antibiotics until now in the 2020s, you can see that there are further research as far as what could other therapies do in order to be as close to a cure for cystic fibrosis. So the CFTR protein is really very complex, as you can see here. And this actually folds into a channel, so it's like really a gating mechanism for the transport of your electrolytes. And in terms of pathophysiology, we know that on the low volume model, because there is differences in the flux of your electrolytes, the endpoint here in the yellow circle is that you have like an altered kind of viscous secretion on the airway lumen. And we actually are saddened because if you have an advanced lung disease, you really have significant bronchiectasis as shown in this CT scan, and most of the mode of death for our cystic fibrosis individuals are respiratory. But the clinical manifestations would really evolve around the following organ systems. The CF Foundation actually started as a support group, and these are the Wise brothers. And one day, Richard heard his mom talking about fundraising for cystic fibrosis. And he said, "Mommy, I know what you're doing. You're doing job for cystic fibrosis." So that's actually how the symbol of the roses evolved as far as cystic fibrosis is concerned. Dare to Dream. It was in 1989 that the CF gene was discovered by Francis Collin, who is now the NIH director in the United States, along with colleagues in the Sick Hospital Children in Toronto. And years after, it was in 1998, Robert Bell, who was the former president and CEO of the CF Foundation, really jumped into pioneering venture philanthropy. That is, the Cystic Fibrosis Foundation, as a nonprofit, actually funded the development of potential therapies by tapping into pharmaceuticals. And fast forward, the first CFTR modulator therapy was approved commercially both in the United States and in Europe in 2012. And it was not until 2019 that Trikafta, which we consider as CF providers as a miracle drug, was approved just right before the COVID pandemic. And so there were a lot of uncertainties as far as the CF pandemic. As you heard, New York was the very first one affected, and we have the first surge. So we actually published our work as far as our experience for cystic fibrosis patient at that time. And we were so guarded and we were so concerned about our cystic fibrosis individuals. We realized that the telehealth medicine really was, we hang on it as our mode of still continuing to deliver care for our patients. As you can see on this graph, it was around the beginning of the pandemic that there was really a change in how we deliver care through the increasing telemedicine. We also realized through our registry data that we actually have a changing kind of landscape of our CF patients. There were a lot more overweight and obese patients, including 40% of our adults. There's a lot of mental health increasing among our adults and adolescent population. And we actually realized that because the CFTR modulator therapy not just really improved lung function, and fascinatingly also evidence that there is really targeting of the basic defect by the decrease of sweat tests. We also realized that our patients are healthier, and nearly 40% of pregnancies were unplanned in CF. Thus, reproductive health became also one of the priorities as far as our focus. So in essence, cure, collaboration, and community is how the CF delivery of care has evolved. And this is our clinical team. We attended the North American CF conference in Phoenix just a few months ago. And you can see our team is very large. There's 14 of us who attended the conference, from our providers to our parent advocate to our physical therapists, our dietitian, and our mental health coordinator and respiratory therapists. So the strength of the CF Care team is really its ability to really respond to the changes and partner with our patients and families. So Stony Brook is part of the CF Learning Network, and we have 36 accredited care centers out of over 100, where we actually share ideas both of our research as well as our quality improvement projects. And almost all of the CF Learning Network teams, about 94%, have patient-family partners, of which 74% are actively participating and taking ownership of our projects. So this is one of our projects that we presented at the most recent conference. It's co-production of care. And I really want to highlight patient-family partners, and Barbara Leva, who's been a member of our IAPS for a number of years now, really is one of our team members, and even take the lead for co-production. In this project, we actually developed a standardized pre-visit planning through quality improvement and made a difference as far as our delivery of care. We have recently published the new era in cystic fibrosis, always changing and always adapting, and really highlighted the effect of the CFTR revolutionary therapy as well as the strength of the clinical team. So in conclusion, CF requires a large, specialized, multidisciplinary care team for effective treatments, and with improvements in CF care and new treatments, our patients are living longer and healthier lives. Their lung function is a primary indicator of health and has improved over time. Collaborative visit planning is occurring in 93% of clinical care visits to shared agenda setting with patients and families in the CFLN centers. So the 3 points to the pediatricians is that a new treatment can change the trajectory of a chronic disease. 56 years and it's still on an upward trend. The COVID pandemic has really changed our practice, and we realize that innovations are here to stay. So right now, we have a hybrid of in-person visits and telemedicine among our patients, and shared decision making and partnership in care is key in today's era of caring for CF patients. So our future directions and implications: advancing treatments for all, because there are still a portion of our patients that's ineligible for the CFTR modulators, and now the CF Foundation is focusing more on gene therapy and gene editing. Optimal hybrid model of care, which includes telehealth, and lastly, addressing health equity in CF, because especially in New York, we have realized that there is diversity among those diagnosed, especially with newborn screening. That's the end.